On the biggest advertising stage in the world, the Super Bowl, a familiar face is delivering an unfamiliar message. Boxing legend Mike Tyson, once known as the most feared man in sports, has stepped into an entirely different ring: America's health crisis. This is not just a commercial, this is not just celebrity branding, and this is not just about food. It is about power, politics, pain, and a growing movement that now sits at the center of the Trump administration's health agenda. MAHA, Make America Healthy Again. In a stark, black-and-white Super Bowl ad released ahead of the game, Tyson looks directly into the camera and says something that instantly grabs attention. "We're the most powerful country in the world, and we have the most obese, fudgy people." No hype, no jokes, no nostalgia. Instead, Tyson shares something deeply personal: the death of his 25-year-old sister from a heart attack he links to obesity. He talks openly about his own past, how he ate anything, how he hated his body, how nutrition fed his self-destruction. The ad ends quietly, almost symbolically, with Tyson biting into an apple next to his son as the words, "Processed foods kill," flash on screen. Then comes the slogan that has ignited national debate: "Eat real food." This is MAHA, short for Make America Healthy. Again, the movement has moved rapidly from online activism into federal policy. Backed by a nonprofit called the MAHA Center, closely aligned with Health and Human Services Secretary Robert F. Kennedy Jr., the campaign has the full attention of the White House, and now millions of Super Bowl viewers. Supporters call it a long overdue reckoning with America's broken food system. Critics warn it's a slippery slope into pseudoscience, vaccine skepticism, and politicized healthcare. And Mike Tyson, a man whose life story is already defined by extremes, has become the most visible face of it yet. So what exactly is MAHA? Why is the Trump administration pushing it so aggressively? And why has a 30-second Super Bowl ad triggered such an intense national conversation? To understand that, we have to look beyond the commercial and into the movement reshaping how America talks about food, medicine, and trust in science. To understand why Mike Tyson's Super Bowl ad hit such a nerve, you first need to understand MAHA and why it's no longer just a slogan. MAHA, short for Make America Healthy Again, is a health-focused political movement modeled deliberately after Trump's famous Make America Great Again branding. But instead of borders, trade, or elections, MAHA targets something even more personal: what Americans eat, how they're treated by the medical system, and who they trust about their health. The movement gained momentum long before the Super Bowl ad, but under President Trump's second term, it has moved from the margins to the center of federal health policy. The core idea of MAHA. At its heart, MAHA argues that America is not sick by accident. Supporters believe ultra-processed foods are driving obesity, diabetes, heart disease, and depression. Artificial dyes, preservatives, and chemical additives are poisoning everyday diets. Corporate influence has corrupted food guidelines, pharmaceutical policy, and medical research. The message is intentionally simple and emotionally charged. Eat real food. Avoid processed products. Take control of your health. That simplicity is part of its power and part of its controversy. Trump's executive order, MAHA, goes federal. Shortly after his 2025 inauguration, President Trump signed an executive order creating the Make America Healthy Again Commission. The commission's stated goals include reducing chronic disease in adults and children, reworking national dietary guidelines, increasing transparency in food and drug regulation, challenging long-standing health policies deemed captured by special interests. In other words, MAHA is no longer an idea, it's policy. The government website featured at the end of Mike Tyson's ad outlines a revised food pyramid that emphasizes whole foods, fresh produce, and protein, de-emphasizes ultra-processed carbs and sugar-heavy diets, frames nutrition as a national security issue. Robert F. Kennedy Jr. The architect. At the center of MAHA is Health and Human Services Secretary Robert F. Kennedy, Jr. Kennedy has long positioned himself as a critic of Big Pharma, a skeptic of vaccine policy, an advocate for medical freedom. As HHS Secretary, he has reshaped advisory panels, revised vaccine guidance, and challenged decades of institutional health practices, moves praised by MAHA supporters and fiercely criticized by mainstream medical organizations. Kennedy has repeatedly called America the sickest country in the developed world. At the center of the movement is the MAHA Center, a federally backed initiative tied to the Make America Healthy Again Commission. Publicly, the center presents itself as an educational hub for nutrition and lifestyle reform. A research coordinator focused on chronic disease, a transparency watchdog for food and pharmaceutical regulation. Its website emphasizes empowerment through knowledge, encouraging Americans to question labels, ingredients, and medical recommendations. But critics argue the center's real influence lies in agenda setting, not education. By choosing which studies to highlight and which experts to elevate, the MAHA Center effectively shapes the national conversation around health. Funding and political alliances. Official funding for MAHA comes from federal appropriations tied to the Department of Health and Human Services. However, the ecosystem around MAHA is much larger. Support networks include wellness influencers and alternative health brands, food companies marketing clean, organic, or additive-free products, political donors aligned with populist and anti-regulation movements. This blending of government authority and private wellness economics is where controversy intensifies. Supporters see it as innovation. Critics see it as ideology replacing evidence. Why doctors and scientists are split. The medical community's response to MAHA is sharply divided. Supportive clinicians argue chronic disease rates are undeniably rising. Nutrition science has been distorted by corporate interests. Patients deserve more autonomy and fewer blanket recommendations. They see MAHA as a long overdue correction. Opponents counter, MAHA oversimplifies complex health issues. It cherry-picks data that supports predetermined conclusions. It risks undermining trust in vaccines, public health campaigns, and evidence-based medicine. Major medical associations have warned that MAHA's messaging could lead people to avoid proven treatments, replace clinical care with online advice, distrust doctors altogether. The culture war element. MAHA does not operate in a vacuum. Its language mirrors political populism. Elites versus everyday Americans. Corrupt systems versus personal freedom. Truth seekers versus captured institutions. This framing resonates deeply with audiences who already feel ignored by traditional power structures. But it also turns health into a culture war battlefield. In that environment, compromise becomes difficult, and nuance often disappears. By the time a movement reaches the Super Bowl, it is no longer testing ideas, it is testing power. MAHA's shift from messaging to policy is where the stakes become real, because the consequences no longer live in debate shows or social media clips. They show up in schools, grocery stores, hospitals, and homes. Schools and children, the first testing ground. One of MAHA's earliest policy priorities has been childhood nutrition. Under new guidance linked to the movement, school lunch programs are being encouraged to reduce ultra-processed foods, artificial dyes, and additives are under renewed scrutiny. Fresh food sourcing is prioritized, even when costs are higher. Supporters say this is a moral necessity. That children should not be exposed to food designed for shelf life, not health. But administrators raise hard questions. Who pays for fresh food at scale? Will poorer districts be left behind? What happens when policy outpaces infrastructure? The fear is that well-funded districts benefit, while under-resourced schools struggle to comply, widening inequality under the banner of health reform. Food policy. Winners, losers, and market shifts. MAHA's influence is already being felt across the food industry. Companies that specialize in organic produce, minimal ingredient products, clean label branding have seen increased visibility and political favor. At the same time, large food manufacturers face regulatory pressure, public distrust, calls for reformulation or warning labels. Critics warn this could lead to health becoming a luxury product, accessible to those who can afford real food, while others are blamed for choices constrained by income and access. MAHA's message is simple. The reality of the food economy is not. Healthcare. Trust on the line. Perhaps the most profound impact of MAHA is not dietary. It is psychological. Public health depends on trust. Trust in doctors. Trust in institutions. Trust in shared facts. When MAHA encourages people to question everything, supporters hear empowerment. But many healthcare professionals hear erosion. Doctors report patients rejecting standard guidance, citing social media over medical advice. Viewing healthcare as ideological rather than clinical. The danger, critics argue, is not skepticism itself. It is selective skepticism, where evidence is accepted only when it aligns with belief. Who benefits? If MAHA succeeds, if MAHA delivers measurable, it could redefine American health policy.